Okay, so the topic is healthcare in this country or the lack thereof it. Now, to give you a perspective, I'm a veteran who was injured in combat. So I'm 100% service connected and I have VA benefits supposedly. Now, one of the topics is I hear people talking about how great our medical system is, and yet I've lived in Japan for like the last 5 years, and the entire time that I came back to the United States, I got pushed out of the system as much as possible. I even had a doctor tell me in Palo Alto that his primary goal, or their primary goal, not his specific, but the VA's primary goal was to keep me out of the system. So this is not a healthcare system. This is basically, you're going to cost us money. I served my country, I got injured, I came back, and it took them 2 years to try to figure out what was going on with me. And they never found out. I even went to Stanford and got checked out for my visual impairment. So I have a major head injury. And so I moved to Japan, who has a single payer healthcare system. Now, one of the things that people associate with single healthcare, at least here in the United States, is that you're going to wait in line for 30 minutes to an hour and maybe you'll get in or whatever. I never once did that. I waited maybe a maximum of 15 to 20 minutes when everybody had hay fevers during the allergy seasons. That was it. And I still got treated on a decent time. And when I moved to Japan, I went in to ask them about, to get help with getting on the trains and stuff. They asked me what was wrong, and I told them that I got injured in war. They said, we would like to do a full checkup on you. They sent me in, and they ran me through MRIs. They sent me through the full work, and they actually found out that the blood vessels in my head were damaged, and the VA never caught that for some reason. Now, I've been poisoned twice by the VA on my stomach medication. The first one has been leaching my bone and vitamin D. The second one was laced with something. So wherever the FDA is, or the drug administration is, it'd be nice if it started working again. But going back to what we consider the best healthcare in the world, how is it a healthcare system when a whole generation of people like my parents have been misdiagnosed just to get them into the system, then prescribed the wrong drugs just because they had to prescribe drugs. And most doctors in the last few decades have been signing agreements to pharmaceutical companies when they get out of their doctorate degree to push prescriptions first. Where's the healthcare in that? And if we have, and going on to the idea of the single payer healthcare system, so the single payer healthcare system is probably going to cost around $20 trillion, or who knows whatever the number is. It's going to fluctuate every time for who knows what reason. But our current system, with all the fraud and with all the abuse, is costing over $30 trillion. If we can afford $30 trillion for no healthcare, why couldn't we afford $20 trillion for healthcare system and actually improve it better than any other country in the world? This doesn't make sense, and I don't know any politician who agrees to that system, or even why anybody doesn't understand that our current insurance company schemes are that destructive. I mean, they've been killing people. They're one of the healthcare industry is probably number one or up on the highest list of people dying in bankruptcy in this country. So we're basically destroying our country and not becoming healthy on it. Does that make any sense?